Hi everyone. What I'd like to do today is take a couple minutes to talk about my core principles of kind of patient management or rehabilitation of somebody that's dealing with some painful problems or having difficulty doing the things they want. So basically the basic foundation of what we try to do here is twofold, okay? Number one, first step is to try to calm the symptoms down. So most people that come to my clinic are having a problem with pain, okay? So the first thing we try to do is calm the symptoms down, and there's a number of ways that we can use to do that. Many hands-on techniques, some stretching or flexibility stuff that we can do. Occasionally we'll do some dry needling, but it's all meant to kind of modify the symptoms to get you feeling better so that we can get on to part two of how we rehabilitate patients. Now, the thing that I see with a lot of the patients that come in here who have seen other healthcare practitioners is many of the other people that help people in pain are just focused on part one, which is calm the symptoms down, get you feeling better, decrease the pain. There's nothing wrong with that, but the problem that happens many times is if that's all you focus on, yes, the pain's going to go away, but most of the time or a lot of times you never get back to functioning the way you want. That's a big problem. Or number two, you're left with getting rid of the pain, and then you do fine for a few months, and then all of a sudden your problem starts coming back. So what we really try to focus on here at ProMotion is, yes, number one, help you with your symptoms, but number two, part two of care is to build you back up. All right, so calm the symptoms down, build the area back up, build you back up so that you can get back to doing everything that you want to do, with number one, decreasing the risk of reoccurrence, and number two, get you back to functioning hopefully better than you were before you got hurt or before you started experiencing pain. And I think that many times is what really helps differentiate what we do here compared to some other places. So calm it down, build you back up. You know, if all you're concerned with is calming it down and not getting back to functioning better, there's a lot of ways you can do that. You can take pills, you can use heating pads, you can just sit around and rest. But in reality, it's not helping you get back to functioning the way that you really want to at the level that most of my patients want to be able to function at, okay? So here we focus on calm it down, but more importantly, when things are calmed down and you can move better, we gotta build you back up. This may involve mobility, getting things moving better. It definitely involves loading the tissues, getting you stronger, getting that area that's been painful and injured built back up so that we can decrease the risk of reoccurrence and get you back to functioning better. So if that sounds like something that you're interested in or a plan of care that you want to try to implement, feel free to reach out to me and I'd be happy to talk with you. Thanks.